Tips for when you're going to the hospital, and this should be able to help you to get better care for yourself and for your loved ones. Tip number 1, do not pee or poo anything that is coming out of your system. It may be required in the hospital, and then you may compromise your care and have to go back home and then get a sample, especially when it comes to things like poo or sputum and the like. So when you're going to the hospital, just do not pee or poo anything. If you are to, if you're dying, go straight to the lab. Tell them to give you sample cups. You put samples in there just in case they're going to be required. Tip number 2, do not do self-requests. The reason for this is that 1, you may do requests that are not necessary for you, but also number 2, it will also be adding to wasting of money. And then it's very important that if you are unwell, go to the hospital and then have a consultation with your doctor. Let them customize a plan for you and customize investigations for you. Otherwise, you may end up compromising your own care by asking for requests which you actually find you may not need just because you think that you may have it. So tip number 3, as much as possible, get insurance. If you can, there's so many insurance schemes, so many insurance plans that have different packages, different rates, different prices. And if you're able to get a place or a workplace where they offer you health insurance, it is always an extra bonus, because health, you cannot know the importance of how your health until it is that you just get a small flu, And then imagine when your health has been severely compromised, and it comes without when you don't really know. So get a health plan. Get a health plan as much as possible, because healthcare is not cheap. And I am a doctor and I'm telling you this, it's not cheap, even us we know. Tip number 4, when you're going for annual checkups, it's important that you don't, I always tend to advise my patients, don't use the wellness packages that have been offered by the hospital. Why? Because you need to be able to have a plan that is customized for you. When a hospital is creating a wellness package, it creates a general package, which is good. But most times you may find that the things that are in there, you do not need them. And then the ones which you need are not involved in the package. That's an extra cost, which you would not have needed to incur. So it's better when you're going to have an annual package, go to your hospital, go to your doctor, set up a consultation, sit with them, tell them what it is that your needs are, your requirements. They'll be able to assess you and say, okay, according to this, and this is a test that you would need, this you won't need, this you will require, this you won't require. So that is just something that tends to be a bit helpful for patients. I hope it helps you too. Tip number 5, do not self-prescribe. This is something I cannot mention more than, I don't know how many times I can say it. Whenever you self-prescribe, you cause yourself harm that you do not require to cause yourself. So when you buy things that you do not need and you put them into your body, they end up causing you more harm and compromising your health. I'll do a video on antibiotic resistance so you can understand how it is that it works and the impacts that it does have on people. Tip number 6, if you are pregnant, make sure to start antenatal early. Do not forget, in reference to the folic acid video, always make sure to start your folic acid 3 months prior to conception. This information you would know if you are sitting under a gynecologist to guide your process, your doctor to be able to make your process a bit easier. Do not miss antenatal for any reason. I have had women who are like the golden mothers. She has like 8 babies. She's on baby number 9. She feels like me. I am the master of this show. I know this, what I'm doing. But as the more you advance in age and the more you advance with more pregnancies, the weaker your uterus gets, the higher the risks of complications. And so for you, because you've been used to doing things this way for all the children, doesn't mean the next one is also going to be the same way. You find they have higher risk of bleeding after having children. The children tend to have a bit more complications, and even the risks of things generally just increase. So it's important for you to go for antenatal, sit with your doctor, let them guide your process, and have you a safe pregnancy and a safe motherhood experience. Tip number 7, gentlemen, when your lady is very pregnant, very heavily pregnant, please help her shave down there. Please help her shave down there. It makes you both look like responsible adult human beings. Because who else is going to get access to that place if it's not you? Just saying. Gentlemen and ladies, do better. Just do better. Take good care of that place. It's very important. Tip number 8. Please ensure that when you have a flu, it is just a flu. Stop using antibiotics for flus. It doesn't make sense, because you're using an antibiotic meant to kill bacteria, to kill viruses. What are you doing except just harming yourself and weakening your immune system? And not forget increasing drug resistance. It's not necessary and it's very harmful. The second last tip, tip number 9, always make a friend. Be polite, be kind. There's so many times when you find that we are in the consultation room and you find either the person who's coordinating the lounge or a security person or a nurse comes and tells you, Doc, I have this patient. She's very polite and she's really kind. She's a very sweet woman. Please, I ask you to help me see her or help me see this person. This is my person. Help me see them. Why? When you create friends and you leave people with an impact of, like when you're a polite human being, most times you're going to get better outcomes. So you'll find that care is prioritized for you. Of course, I understand that there are times when you find things are really intense and you have to almost demand for care, and that's okay. But when someone becomes a bit problematic, it's distasteful and it rubs people the wrong way. So just so you know, next time you go to a hospital, it's better to make friends than enemies, because that's healthcare. Like your health will be compromised and you don't need that. And the last and final tip, there's some pieces of information that I would always want you to volunteer, even before you are asked. Volunteer this information because you do not know what drug is going to be given to you, what test is going to be given to you, what finding is going to be made. Volunteer these 3 pieces of information. 1, if you are pregnant or if you think you are pregnant, volunteer that immediately, because there are some drugs, even just drugs like diclofenac or a painkiller or ibuprofen, there are some things you may just come to hospital and you're in severe pain and something is going on. These drugs, if you get them and you're pregnant, they can compromise the health of your baby. So there's some things you need to do. Make sure that you volunteer that information as soon as you get in there. Another piece of information you should volunteer is any drug allergies. Do not wait for anything to be administered to you or prescribed for you. Before you are asked, volunteer that information if you know it and if you have it. The final piece of information you should always volunteer is chronic illnesses. If you're diabetic, if your blood pressure is high, if you have any autoimmune diseases, anything else that you know that you could be having, just make sure you always volunteer this information and do not sit with symptoms at home. Just do not do it. So that is it for today. Those are some hospital tips. Let me know if you're a healthcare worker and you have other tips that you would like to share. Tell me if you've learned something. Tell me, class dismissed.